and we're here with Dr. Vitale. Dr. Vitale, thank you so much for joining us today.
Of course, thank you for having me.
Can you tell us a little bit about your background?
Sure. So I'm Chris Vitale. I'm a fellowship-trained, board-certified orthopedic trauma surgeon, and so essentially what that means is that I care for all musculoskeletal injuries, but more specifically high-energy trauma, so things like motorcycle accidents, motor vehicle accidents, and falls.
And that's what we're talking about today, is the risk for falls and some prevention for older adults especially. I happen to think about, young kids can just fall on the ground and bounce right back up without any fear. And I think as we get older, we tend to worry about falls. And this is actually a big risk for older adults.
Right. So our population is aging. So the segment 65 and older by 2050 is going to make up 1 out of every 5 people. And so with that aging population comes an increased risk of falls. And so things that might be minor to someone that's 18 years old can be very significant to someone 65 and older. A lot of that has to do with our bone health as we age, osteoporosis, decreased bone quality. It really takes a toll on our bodies.
And what are some of the injuries that can result from a fall?
They're really wide-ranging, something as simple as a wrist fracture that can be treated in a cast to something as significant as hip fractures, pelvis fractures, spine fractures that can really require some extensive surgical intervention. Fortunately, though, we have a lot of great surgical techniques to care for this, but it's a long recovery process. As we age physiologically, we're not able to handle some of the stresses, and so the impact on someone in the aging population is very different than someone that's in their early 20s and 30s.
So really there's a lot more complications for an older adult than if they sustain a fall?
Correct. And so a lot of that's related to more the underlying medical comorbidities that they might have, things like high blood pressure, heart disease, lung disease, diabetes. And so unfortunately patients over the age of 65, when they suffer things like a hip fracture, about 50% of them drop down one functional level, meaning that if they weren't using a cane or a walker before the injury, they most likely will be relying on one going forward after the injury, even in best case scenarios.
So if someone does sustain a fall with some injuries, can you talk a little bit about what their recovery might be like?
Sure. So recovery for a patient who's 65 or older is very different than a young patient, and approximately 25% of patients have to go to some type of a rehab facility to recover. It might be anywhere from 2 weeks to 6 weeks post-operatively, but in the beginning they're often only partial weight bearing if they have a hip fracture, and so it significantly limits their ability to ambulate, and so recovery can be up to a full year after a major trauma in a geriatric patient.
And just because as they're older, it maybe takes longer to heal, but there's so many, you had mentioned so many of the different types of injuries, from maybe a wrist fracture to, even a head injury, correct?
Right. And not only that, and it can exacerbate a lot of their other medical problems. So they might have come in, they have this hip fracture, and now maybe their COPD flares up or their diabetes gets uncontrolled. And so unfortunately, it's much more than just the isolated broken bone that we care for in orthopedics. So it really is a team approach, and so it takes the internal medicine team, the cardiology team, sometimes the endocrinology team to really get the patient back to 100%, and that can take a lot of time, like I said, up to a full year for recovery.
So as a family member, how can we help someone to help reduce their risk for fall?
Sure. I think one of the big things that family members can focus on is looking at the medications that their loved ones are on. Sometimes they're not supposed to be mixed together, or sometimes, if they're mixed with an alcoholic beverage, that can increase their risk for falls. A lot of the medications that we take can make you drowsy, and that in and of itself can cause a fall. So I think that if you can go to the office visits with your loved ones and go over the medication list with the providers and make sure that there are no interactions, things like that. Again, making sure that their home is safe, and then trying to help out with any chores that they might have that could put them at risk. Keep them off the ladders, keep them from outside doing the snow and things like that.
Great. Because especially as we get into winter months, being maybe more aware of that.
Definitely.
And what are some of the risk factors for someone to maybe have a fall?
A lot of the risk factors are modifiable just within the home. So risk factors are poor lighting in the home, things like real dim lit stairways, having a laundry room that's down in the basement as opposed to on the main level. Throw rugs, so area rugs that people like to decorate their homes with, are a huge fall risk, especially in the middle of the night. Icy areas when they're going to get the mail, taking out the garbage, things like that. So a lot of it can be modified very easily to try and prevent those falls.
And is it true that once someone has a fall, they're at risk for additional falls then?
Yeah, it's actually a great point. So if you sustain a fall, you're age 65 or older and you sustain a wrist fracture, you're at about 25% risk to have another fall in the first year after that injury. So repeat offenders, we see that quite often.
Yeah, and I think they have more fear of falling. Is that tied to it, do you think?
It can be. There's definitely a greater fear of falling, especially in the elderly, people that are 80 and 90. They always have this great fear of falling. That's why we really, really try to promote fall prevention. So using the walker and the cane, relying on your family and friends to do some of the household chores that maybe you're doing before, no longer getting up onto a step stool, things like that.
Yeah. How common are falls in older adults? Like, how often do you see them in the ER?
So because the population is expanding, it's probably one of the most common things that we do. So by 2050, about 40% of trauma patients that we see are going to be geriatric related, which is age 65 and older. And so about 1 out of every 10 Americans will suffer a hip fracture in their lifetime. So that's really significant. If you think about, 1 out of every 10 people will sustain this major trauma.
Right. And then you hear about the people that maybe had a fall and no one was around and they maybe laid for a while. Can you talk a little bit about the risk that's involved with that?
Sure. A lot of times some of those issues are that maybe the fall was related to things like dehydration, poor nutrition, so they have this fall and then they don't have the ability to get up. And so again, making the home where you have a phone accessible at all times, or things like the Life Alert and things like that, because no one plans to have the fall, but unfortunately sometimes they're related to other underlying medical issues, and then maybe they can't get to a phone, and sometimes patients do, unfortunately, can take them a day or so to get to the hospital.
And it just would be so scary, I would think, for them too. You can see how that could really increase their risk or fear and make them at risk for another fall.
Sure, absolutely.
Dr. Vitale, you had mentioned that you're a certified trauma surgeon. Can you talk a little bit about the services that are available at McLaren Macomb?
Sure. So at McLaren Macomb, we're a verified level 2 trauma center by the American College of Surgeons. And so what that means is that we have a multidisciplinary approach. When a patient enters our trauma bay, that patient doesn't know what services they need. So you never choose what trauma center you go to. But when you go to a center that is verified, you have every service that might be needed, whether it's orthopedic trauma surgery, neurosurgery, the general trauma team. They're all available and they're all in-house at all times. So for example, if you come in as a trauma patient and you have a significant orthopedic injury, they'll always call one of the 2 fellowship-trained orthopedic trauma surgeons, and no matter what your injury is, we have the skills and the technology available to care for you. So when you come to our ER, you might come in with hip pain and there's a suspected hip fracture, but oftentimes patients are on blood thinners for whether it's underlying heart disease or previous blood clots. And so when that patient gets admitted, they're not just being worked up for their hip fracture, they're being worked up by the neurosurgery team for a potential brain bleed, being worked up for potential lung injury. And so being the verified trauma center, we have all these services available. And to that point, McLaren Macomb has kind of an interesting setup where we have 2 fellowship-trained orthopedic trauma surgeons. We're actually the only 2 in all of Macomb County. And so we are a large referral center, especially for areas to the north of us, like Port Huron, Lexington, areas like that where patients will be sent down specifically for our services. We also take care of not just the aging population, but the very young population. So we also take care of pediatric patients, both surgical and non-surgical, with orthopedic injuries.
Do you have any other closing comments today?
I think the big thing that I would like to promote as far as fall prevention is a good exercise program. You're never too old or young to start an exercise program. That's going to make you stronger and prevent falls. Like we talked about home modifications, so good lighting, handrails, if you need a seat riser on the toilet, anything to prevent a fall. And also, in Michigan, we kind of have some unique weather with the ice and the snow, and so something as simple as getting the mail or taking out your garbage can really cause a major traumatic event. So relying on friends and family to maybe help you with some of those chores during the winter months really goes a long way to preventing any traumatic event.
Yeah, this has been great information. Thank you so much for joining us today.
Thank you for having me.
Learn more at mclaren.org/Macomb Trauma.